Is there a link between myalgic encephalomyelitis, also known as chronic fatigue syndrome, and schizophrenia? Now, on the face of it, that might seem like a very unusual question to ask, because surely these conditions have nothing to do with each other. And some people might even have an understandable knee-jerk reaction to such a question even being posed. Does that mean that I'm suggesting that ME-CFS patients are simply schizophrenics and that their symptoms are actually explained by having this severe and persistent form of mental illness? Now, to be absolutely clear, that's not what I'm suggesting at all. And rather, to cut a long story short, what I wonder is the following. Can the pathological mechanisms within ME-CFS, particularly those that cause inflammation in the brain and reduced blood perfusion in the brain, lead to psychological and personality changes which could, if looked at from the wrong angle, be misinterpreted as schizophrenic symptoms? In this video, I'm going to explore this question in more detail, including an amazing research paper from all the way back in 1938, which makes this possible link quite likely. But first, if you are new to this channel, my name is Patrick Usher. I'm an ME-CFS patient, and this is a place where I share the research into ME-CFS and long COVID in an accessible way, and also where I talk about my various efforts at trying to improve my condition. If that sounds of interest to you, please do like and subscribe. Now, if schizophrenia is something that you are completely new to, I'll just say a few words about it. It is a form of severe and persistent mental illness, and it involves two main categories of symptom: positive and negative. Positive symptoms refer to those which are developed after the onset of schizophrenia. These are symptoms that the person did not have before. And positive symptoms of schizophrenia would include things like delusionary thinking, hallucinations, whether visual or auditory, and confused thought patterns. And then when it comes to negative schizophrenic symptoms, the negative refers to these are things that the patient has actually lost, so they have lost certain capacities. That's why it's considered negative in this case. And these include the following kinds of symptoms: anhedonia or lack of pleasure, flat emotional affect, feeling isolated, becoming averbal or having being much less descriptive and spontaneous in conversation. So, for example, using short, non-descriptive answers to questions, difficulty with verbal memory, prefrontal cortex functions, attention, working memory, processing speed, avolition, so not really wanting to do things, alogia, a very limited spontaneous speech, poverty of speech, reduced experience of emotion, lack of facial expression, difficulty organizing life, excessive activation of threat response in the amygdala, and having difficulty making eye contact, and experiencing things like paranoia or feeling easily humiliated in situations which are not objectively humiliating. So these are symptoms of schizophrenia, and people can maybe be oriented more towards the negative symptoms or the positive, have a good mixture of both, but in general those are what are termed schizophrenic symptoms. So now let's come to the question of ME-CFS and schizophrenia, and would you believe in the last few years there's actually been a research team looking at links between schizophrenia and ME-CFS, and they have published several papers on this. So let me tell you about them. Now, there are a few papers from this research group, but let's just start off with one of them. Chronic fatigue syndrome and fibromyalgia-like symptoms are an integral component of the phenome of schizophrenia, neuroimmune and opioid system correlates, published in 2020. So what they did in this paper was they measured various markers associated with neurotoxic immune pathways and lowered immune regulation in schizophrenic patients. And these kinds of markers had also been found to be associated with ME-CFS. They also asked these ME-CFS patients to complete a survey called a fibro-fatigue scale, in which ME-CFS and fibromyalgia-related symptoms are measured in terms of their intensity. Now, what the results showed were really interesting, that the higher people scored on this fibro-fatigue scale, the more schizophrenic symptoms they had. So that means that the more the ME-CFS symptoms, the more these patients had psychosis, hostility, excitement, formal thought disorders where you are really thinking in a very illogical way, psychomotor retardation where brain and body are slowing down, and negative symptoms of schizophrenia as compared with patients who had less symptoms of ME-CFS. This paper also found that the various blood markers for neurotoxicity and lowered immune regulation correlated again with the fibrofatigue scores. So this is extremely intriguing. Another one of their papers, chronic fatigue and fibromyalgia symptoms are key components of deficit schizophrenia, that's the negative schizophrenia I've been telling you about, and are strongly associated with activated immune inflammatory pathways. So in this paper, they found that the negative symptoms of schizophrenia have a particularly strong correlation with the symptoms of ME-CFS patients. So that's less of the hallucinations, the delusions, and more of the things like blunt emotional affect, difficulty with social interactions, feeling more withdrawn, and those kinds of things. And finally, in another paper that they did, there's another really interesting link. In schizophrenia, chronic fatigue syndrome and fibromyalgia-like symptoms are driven by breakdown of the paracellular pathway with increased zonulin and immune activation associated neurotoxicity. So what that paper is looking at is the paracellular pathway, which is, a leaky gut and are toxins from foods and other substances getting through the gut wall into the bloodstream and causing an autoimmune reaction and neurotoxicity. So looking at that dynamic and finding that indeed ME-CFS patients with increased neurotoxicity via that pathway of leaky gut had more schizophrenic-like symptoms. What these papers essentially speak to is there something in the nature of ME-CFS, in the way it causes immune system overactivation or the way it causes neurotoxicity in the brain, that actually essentially leads to a psychological profile that is similar to or the same as schizophrenia, with a particular emphasis on negative schizophrenic symptoms. And so this raises the question, if an ME-CFS patient were to go to a psychiatrist, and that psychiatrist knows nothing about ME-CFS but only sees a snapshot of the psychological profile of that patient, would that patient receive a diagnosis of schizophrenia? Now, I want you to think for a moment, what is it like for you when you are in a crash, when you're experiencing post-exertional malaise? How does your personality feel at that time? Do you feel like your normal bubbly self? Or do you feel very withdrawn? Do you feel emotionally very flat? Do you find it hard to communicate with people? Do you prefer to speak in short sentences? Is it just far too much to even try to have a normal conversation? Do you feel very anxious at those times? Do you feel like there's a kind of wall between you and other people? Is it difficult to feel empathy? Is the brain fog very intense so that you actually really have difficulty finding words? And if the answer to those questions is yes, is it possible, this is the speculation, but is it possible that what you are experiencing at that moment is in effect consistent with negative schizophrenia? I think there's an argument that it could be. I'm not saying for sure, but given these papers, and given the strong similarity between symptoms, and given what I'm about to share with you in a moment, I think that there's a strong argument that it could be the same. And so what I'm wondering is the following. Has it been the case that at least regarding a subset of people who are diagnosed with schizophrenia, that actually those patients are suffering from ME-CFS, and because ME-CFS leads to personality changes for all kinds of reasons, and because the medical system is so ignorant about those biomedical problems within ME-CFS, that when those patients present to the medical system, they end up eventually getting taken to a psychiatrist. The psychiatrist sees a snapshot of that patient simply suffering with, flat affect, inability to say very much, etc., and they receive a diagnosis of schizophrenia. And so actually, is this, at least in some cases, a big historical and current problem of misdiagnosis, even though it is in fact also schizophrenia? As I say, this is speculative. I'm really interested to hear what you think, but I think there's some kind of connection here, and that's not to say that there might not be other mechanisms that lead to very similar problems unrelated to ME-CFS that also create what looks like, and in fact also is, schizophrenia. But now let me bring you to something which I think is truly mind-blowing and which could clinch the connection between schizophrenia and ME-CFS. Because what you would want is some kind of accidental finding from schizophrenia-related research that ties in precisely with findings from ME-CFS in a very direct way. And what we know, absolutely essentially characteristic of ME-CFS, is low blood volume, not having enough blood. And typically speaking, ME-CFS patients can be a litre short on blood, particularly if they are in the more housebound kind of category. So is there any research finding from schizophrenia which shows the same? Now, unsurprisingly, this isn't a question that's been investigated very much. But if you go all the way back to 1938, there was a paper that looked at precisely this question, and the results are absolutely mind-blowing. So this paper from 1938 was published by Finkelman and Hafron, and its title was Observations on the Circulating Blood Volume in Schizophrenia, Manic Depressive, Psychosis, Epilepsy, Involutional Psychosis and Mental Deficiency. And here is a summary of that research by someone from a year later called G.W.T.H. Fleming, because I couldn't actually access the original paper, it was behind a paywall. But the summary is the following. The writers found a low circulating blood volume in patients with schizophrenia, as compared with manic depressive patients whose circulating blood volume was basically normal. The schizophrenics had a blood volume per square metre of body surface of 2,609 cc, as compared with 2,973 cc in manic depressive patients. The plasma volume in schizophrenia per square metre of body surface was 1,433 cc as compared with 1,727 cc in the manic depressive patients. The diminution in the circulating blood volume in schizophrenia appears to be related to disturbances in water metabolism, capillary permeability and vasomotor tonus, secretion of the antidiuretic and vasopressor hormone of the posterior pituitary gland, basal oxygen consumption rate, and indirectly heat regulation. These failings may be due to dysfunction of the hypothalamus. I'd imagine that if you're an ME-CFS patient watching this, your jaw is dropping right now. I don't know why this hasn't been picked up on more, but the fact is this is exactly the same pattern as in ME-CFS. Full stop. What we have from this 1938 paper is a total blood volume reduction of around 12%, which is completely consistent with ME-CFS findings like those from Visser and Van Kampen, and a plasma volume reduction of 20%. And again, that's very consistent because in ME-CFS the plasma volume tends to be lower in the reduction rather than the red blood cell volume. And interestingly, the way this paper from all the way back in 1938 described the likely origins of the problems with fluid regulation, basal oxygen consumption rate, heat regulation. That's right from the ME-CFS research playbook. And so this is why I think that actually there is an enormous link here, and that some ME-CFS patients are being called schizophrenics, and they are schizophrenics, but not for the reasons that people in the medical profession think. They're schizophrenics because the illness is making their brain really unhealthy. It's getting it really dysregulated, neurotoxic, lack of blood perfusion, and as a result the brain function is reducing. And then the personality is changing. Now, there were a few other studies. I'm not going to go into detail here, I've gone on long enough. There was a study that also found more recently a reduction of blood perfusion in schizophrenic patients. And in schizophrenic patients, just like in ME-CFS, there is a lowering of antidiuretic hormone, also known as vasopressin, which is the hormone that maintains water balance, as well as various actual social functions as well. And so all of these things speak to a similarity. Now, I'm going to share my own personal experience with all of this, because the kinds of symptoms that I read about, that I told you about earlier in relation to negative schizophrenia, I suffer from those symptoms. And I particularly suffer from them when I'm in a crash. When I am feeling more well, they kind of diminish quite considerably, maybe not entirely, but they do diminish. But when I am in a crash, when I'm very unwell, those symptoms are my life. And I actually find, this is all quite hard to take personally when I, think about all the things one has to do to try to recover from this blasted illness. This is another hurdle. But, I have struggled with this kind of thing, with flat emotional affect, with feeling very stilted, with not feeling like myself, with struggling to relate to people. When I'm talking to someone in a crash, I really make my best effort, but it is bloody hard. And I hate it because I don't feel myself. I can't relate normally. I kind of know what to say, but the face and the expressions and the emotions don't follow. So anyway, that's my personal experience with this. And I would have been quite resistant to all of this before, but I think that when it comes to an illness like ME-CFS, it has been so ignored by the medical profession that it's perfectly feasible. They could be looking at ME-CFS patients from the wrong angle. They build up a whole literature around schizophrenia in relation to that because they're not looking at the big picture, and then that becomes established. And actually they've perhaps all along, at least in a subset of patients with diagnosed with schizophrenia, they've actually been looking at people suffering from low blood volume and ME, and who are just struggling with personality and psychological changes as a result of their chronic illness. So as I said, this is a much more speculative video. None of these things have been proven, even though there are these very interesting links coming out in some, from this research group that I mentioned. But I'd be really interested to hear what you think. When you're in a crash, how do you think you feel socially? Could that be interpreted as negative schizophrenia? Do you have experience with these sorts of schizophrenic symptoms? Have you suffered from even things like auditory or visual hallucinations? Have you ever thought the TV is talking to you? These kinds of things. So I wonder if there's a link. It's more than I can kind of take on. So I just thought I'd chuck it out here, see what people think, and put the idea out into the ether and see if it leads to anything. But anyway, that's it for this video, and I really look forward to your comments. I'll see you in the next video, where I'll be talking about a somewhat cheerier topic, insofar as that's possible with this blasted illness.